Okay, this is a continuation. Here again, this is Meldita and I'm back. Here at my YouTube channel, MELDITA'S Info Corner. My FB is johnregacho@yahoo.ca. Okay, so before kidney transplant, okay, there is the so-called workup phase by the transplant team. Okay, there's the workup phase and they will investigate the patient's medical history. Okay, they will investigate the medical history, the medications taken, operations done in the past, and if there are follow-ups with doctors and the current status. They will also investigate diagnostic procedures, ECGs, chest x-ray, kidney ultrasound if there is, Holter for cardiac patients if they have some problem with their heart, okay, and if there are follow-ups with their doctors and what's the current status. So the patients have to be cleared up from their medical conditions or any diagnostic procedures before they will be accepted for transplant list. Okay? And then there are blood works like complete blood count. We have electrolytes. We have lipid profile, the liver profile, hemoglobin A1C. Okay? And there's also the blood group, which is very important, or the blood type. Because if the patient's blood type does not match with the donor type, then they will not be compatible. There will be no transplant to happen. Okay? So there is a blood grouping, the blood type, and screening. Screening for infectious diseases like hepatitis, HIV, and more. They will also do urinalysis. There's also psychological factors, checked. And there's a compliance. Is the patient going to comply after the procedure done? Okay, that's very important. Okay, talking about blood grouping or blood type, here, we have the ABO group system. These are the different blood types in here. We have the type A, B, type AB, and O. So these are the four major blood types. When you say type A, because there's an antigen at the surface of the RBC. If you say type B, there is a B antigen at the surface of the RBC. If you say AB, there is an A and B antigen on the surface of the RBC. For the type O, there is no antigen. So type A has also B antibody coming from the plasma. Okay. Okay. Antibodies are actually like soldiers in the military. So any foreign body, they will deal with it. Okay. So the type A has B antibody. The type A has B antibody. The type B has A antibody. The type AB has none. And the type O has A and B antibodies. Okay. So what is Rh factor? This is actually the rhesus factor. This is actually the antigen, the RHD antigen. And this is actually found on the surface of the RBC or erythrocytes. When we see a type A Rh positive, that means that the blood type of the patient is type A, but there is with antigen, so it's positive. If you say Rh negative, that means there's no antigen. Okay, so let's talk about the blood type of the patient. So this is the blood type of the patient, and this is the donor type, okay, to be accepted by the patient. So let's take a look. So this is the blood type, and what blood type can match with the patient. So we have a type A, positive. So the donor type should be A positive and negative, and O positive and negative. If you have a type A negative, it should be A negative and O negative. If it is B positive, you can have B and O positive and negative for both. And if you have B negative, it has to be negative again. Rh negative cannot have Rh positive. So Rh negative is to Rh negative. So negative is to negative. AB positive can have this blood type donor. AB, A, B, and O, all of them positive and negative. If it is AB negative, again, as I told you, it will be all negative. From AB, A, B, and O, all negative. If you are type O positive, your donor will be O positive and O negative. And if you are O negative, your donor should be O negative. So just remember that the type AB positive is actually a universal recipient, and the type O negative is actually a universal donor. Okay, So when do you say compatibility is a success? Remember, if you don't match with the donor, there's no transplant gonna happen. So you have to be compatible in order, for the transplant to be done. Okay. So the compatibility is a success, or there's a better new kidney acceptance. First, the blood group compatibility. So we showed you the compatibility here, the list of the compatibility. The tissue typing is done. Number 2, with genetic similarities from both parties, the recipient and the donor. And the cross-matching or the mixing of the blood of the patient and the donor has to be done, and there should be no cytotoxic antibodies. Cytotoxic antibodies, these antibodies can actually kill the donor cells. That's why they need this cross-matching to see that there are no cytotoxic antibodies. Okay? That's about it. Thank you.